Hello everyone. In this video, we'll have a quick review of vasculitis. This flowchart will help you to quickly revise vasculitis before your exams. You can add your own points. So let's classify vasculitis. It will be first classified into large vessel, medium vessel and small vessel vasculitis. Now, talking about large vessel vasculitis, we have two types like giant cell vasculitis and Takayasu vasculitis. So in giant cell, remember the history will be that patient will be mostly of more than 50 years, and most common artery involved is temporal artery. There will be history of headache and most specific is jaw claudication. Now in Takayasu, remember the most common involved will be subclavian artery and the age of the patient will be less than 50 years. Now let's talk about medium vessel vasculitis. In medium vessel vasculitis, we have polyarteritis nodosa. Most common involvement will be of renal artery, and in the question it will be mentioned that pulmonary artery is not involved, and it is very regularly asked that it is associated with which infection. So it is hepatitis B, and it will be transmural and patchy. Now coming to Kawasaki Musculitis, we'll see anti-endothelial cell antibodies. There will be history of strawberry tongue, mucocutaneous lymph node syndrome, and most commonly coronary arteries will be involved. Now in small vessel vasculitis, we have immune complex mediated and ANCA mediated vasculitis. So in immune complex mediated, we have HSP, non-Schonking purpura. It is a IgA vasculitis. We'll get a history of palpable purpura, GI pains and hematuria. And immune complex mediated, SLE is also immune complex mediated. Now let's talk about ANCA mediated, which is like it can be C ANCA or P ANCA. For this you can remember a mnemonic like Commonwealth Games. So C ANCA is associated with vaginous, and it has respiratory and renal involvement, granulomas and nasopharyngeal involvement will be there, and there will be hemopsis. Now in Churg-Strauss, you'll have history of asthma, allergy and polyps, and peripheral eosinophilia will be present. In microscopic cholangitis, there will be no granulomas and will P ANCA associated and no nasopharyngeal involvement. So this is the flowchart of vasculitis. I hope you'll be able to solve most of the questions and you can add your own points. Thank you.